Hello. Last week we started a dialogue related to the recently put forth vaccine mandate rules that came out of the federal government about a week and a half ago. And we've pledged to keep this communication open and going. And so this is sort of the next installment of that. And so I look forward to sharing what we know and what might come next. And just admittedly, we don't know everything yet. And we'll tell you that too when that's the case. There are a lot of rules being written right now outside of our organization that provide us guidance in these matters, and so we're assimilating those rules. We're trying to understand them, and frankly, would rather be a little bit cautious and maybe slow even to some before we put things forward, because we definitely want to be correct with what we share. And I know there's a lot of confusion, which is why we want to be cautious. And frankly, I know there's a lot of anxiety about all this for various reasons amongst all of us. And so, again, another reason why we want to just be thoughtful and cautious as we go. And so we'll keep that communication open. And this video is one way for us to do that. So we continue to advocate everywhere we can, trying to get interpretation of these rules in a sort of more favorable light, allowing us to support our workforce and certainly support those we serve through our application of these rules. We're doing that at the state and national level, and we'll continue to do so. Wellspring has sort of always sort of had that focus in the work we do. I want to identify that there are two major federal agencies that we're working with on this that are putting rules out. One is the Center for Medicare and Medicaid Services, or CMS is called. The other is OSHA, the Occupational Safety and Health Administration. If you work at Wellspring, you will fall under one of those mandates, and they're similar but different. The CMS rules apply to everything we do in the healthcare space, which very succinctly is our skilled nursing facilities, our home care and hospice agency. And so because those are licensed healthcare entities, they will fall under those CMS rules. So CMS says if you work in a healthcare facility, we as the employer are now required to assure that all of our staff are vaccinated. And we have until January 4th to make sure you've had your second shot and moving towards fully vaccinated at that point. There is no testing out for that, which is a little bit different than OSHA, which I'll talk about in a moment. And we're beginning to understand that staff that move in and out of these facilities or these entities that may not work there all the time, but need to do work in there from time to time, like myself, would fall under the CMS guidelines, even though I don't work there all the time, but because my job requires me to be in there, that I will fall under that. So there's a little bit of gray area. We're trying to straighten that out. OSHA, on the other hand, which is everybody else, requires that vaccination, same date, but also allows for a weekly testing as an alternative to being fully vaccinated. And so we're working through the rules of that and how we might be able to do that in terms of testing staff, some of whom don't come to an office on a regular basis. So obviously there's complications there, but we're working through that as well. So there are really three specific things I'd like you to know and know about, and just be aware of as we go forward. There'll be more coming out on some of these. One is because we are required as the employer to assure either vaccination status or in some cases the testing option, we have to record keep that now. We haven't always done that. We know that a little more fully, certainly in our skilled nursing facilities, for instance, because that's a different sort of environment. But in just about everywhere else, we don't have vaccination status. So just earlier this week, we sent out a pulse survey, a quick survey in our using our We Care Connect partners I think we asked like 3 questions in there about your status and what your intention may be in terms of if you haven't taken it, do you intend to take it at some point? And so it's a very quick survey, but we really just need to get a baseline. We're not asking people to commit to anything. We just want to know where you're at right now. That would be really helpful for us if you would do that. It's come through email. It can't take more than 30 seconds to click a couple of buttons once you get there. The other does have to do with testing. There's been a lot in the press about the testing option and suggesting that employers will not be paying for that. The rule actually says, interestingly enough, that employers are not required to pay for that, which is a little bit different. I know some folks have heard in the news, that it's stated a little bit differently, or maybe they heard it differently. Here's where we're at with that. Wellspring If that option is available to you and you choose it, Wellspring will pay for that testing. We're making that commitment because it would be part of your job requirement. We're making that commitment through March of 2022. And the reason we're doing that is because technically these rules end at that point. Now, they likely will be renewed with some changes, and we'll consider it then. But just know that consistent with the dating of the rule, we are making that commitment to go along with that. So I know there's been some concern about that. And so if you've been concerned about that and you feel like you're going to be eligible for that, or that's an option that you're going to follow, just know that that's not going to be an expense that's going to fall to you. A lot more details about how we're going to do all that and so forth to come, but that's one box you can check as we go. Also, there are exemptions allowed under both CMS and OSHA, exemptions to the rule. And they're very different and specific. One is a medical exemption, which will require a person who has a medical reason not to take the vaccine to have their physician document that and provide that documentation to us for our records. And there are certain criteria that have to be met, but that is really triggered by that doctor-patient relationship and the documentation that follows. The other exemption is for a religious exemption, which is not as sort of black and white as a medical exemption would be. And so we're working on developing those rules and understanding them. And I know Al Cowell and his HR team are working very, very hard to develop that process, get those applications established, and be able to get those in your hands for those of you who are thinking that might be something that applies to you. And so more to come on that. And when those applications come to us, assuming some will, we will be looking at those on a case-by-case basis. There's no blanket yes or no to any of this because there are rules we have to follow on the back end as well. But we will certainly follow the guidelines that we're given and provide everybody an opportunity to consider all of this along with us. So be patient as we work through these. We're going to continue to share with you what we know when we know it and point out the things we don't know at any given time, as I've done here today. So we recognize that there are legitimate reasons why some people can't or shouldn't receive the vaccine. Again, those medical exemptions being a great example. But we also recognize that those situations are frankly quite rare. And so for the vast majority of us who are eligible to take the vaccine, we still continue to recommend it. We recommend it because frankly we know it works. And for a long time it worked for us to really get the number of cases down. Now we know the number of cases are growing again, and what we're seeing are breakthrough cases. We've seen them even at Wellspring in the last week or so. And that's the pattern we're seeing in our communities. And breakthrough cases are interesting because people who have had the vaccine are still testing positive. But what we know about those folks is that while they may test positive again, they have very mild symptoms. Hospitalizations in those cases are rare, and deaths due to those secondary cases or breakthrough cases are literally unheard of. And so while it may not prevent completely getting COVID, these vaccines are very effective in helping keep people out of real trouble with that, with the disease. So we continue to really encourage folks to consider and get that vaccine. And so finally, as we have this conversation, through these videos and certainly around the meeting rooms and Zoom meetings and team meetings around Wellspring, however that goes for you, I just want to remind folks that, within the walls of Wellspring, such as it is, we want to honor people's opinions and decisions about this. We want to respect people. We want to support people as folks may make an individual decision for them. Our desire is that we would not lose anybody along the way here. I can't guarantee that, and certainly pray that doesn't happen. But whatever happens, we're not going to allow the way the world is dealing with things right now to find its way into Wellspring. We will not allow this to become divisive, to create conflict, to pit people against people. That's just not our way. We will honor and respect everybody and listen to voices, all voices and opinions, because that's who we are, and that's who I want to be. and that's why I'm asking everybody else to be as well as we go. So I again, just always appreciate an opportunity to say thank you. It's been a long 20 months. Many of you, we've been through the grind on this. We continue to do great work. I couldn't be more proud of the work you all are doing. The people we've supported, lives continue to be changed. Families are being strengthened, and our work is continuing, and I'm really, really grateful for that. So thank you for that. God bless. We'll talk again. Thank you.